Sir, Om Shri Gurubhyo Namaha. Good afternoon to one and all. Myself, Dr. Hasina Begampi, second year PG scholar, Department of PG Studies in Kaya Chikitsa, Government Ayurveda Medical College, Mysuru. A very warm welcome to everyone. It gives me an immense pleasure and honor to host this virtual event, a national webinar series on critical management of critical cases in Ayurveda success stories, which is done on the eve of Golden Jubilee celebration organized by Department of PG Studies in Kaya Chikitsa, GAMC, Mysore. I now offer my welcome and salutation to the eminent personality of Ayurveda and guest speaker of today's session, Dr. Rajnikant Patel sir, a chief Ayurveda physician at Agnivesha Ayurveda Hospital, Surat. I extend my respect for our principal, Dr. Gajanan Hegde sir, our beloved HOD, Dr. Maitre RC ma'am, HOD and staff of all the PG studies, Government Ayurveda Medical College, Mysuru. Lastly, I welcome all the viewers for virtually and actively participating in today's national webinar series on management of critical cases in Ayurveda success stories. Ayurveda, the traditional system of medicine originating in India, offers a holistic approach to managing critical health cases. It emphasizes the balance between body, mind, and spirit and utilizes natural remedies, lifestyle changes, and dietary adjustment. So, when it comes to the critical care management, the term critical care means these are the medical situations where patients are in life threatening conditions and require immense and intensive medical interventions. In today's era, we come across many such conditions like MI, CVA, and COVID 19. In the past few years, when the whole world was facing difficulties in treating the pandemic, Sir has specialized in treating more than 1500 mucormycosis cases using only through Ayurveda. So let us know more about our today's session holder. I request Dr. Pooja IMM, second year PG scholar from the Department of PG Studies in Kaya Chikitsa, to give an introduction and welcome Sir for today's webinar session. Thank you.
Good afternoon, all. It's a privilege for me to introduce today's guest speaker, Dr. Rajnikant Patil sir. Sir has completed BMS from Atreya Ayurveda Medical College Hospital and Research Center, Bangalore in 2014. Since then, Sir is doing Ayurveda practice in Surat city of Gujarat. Currently, Sir is a chief Ayurveda physician at Agnivesh Ayurveda Hospital in Surat, which is 15-bedded hospital with fully equipped Panchakarma theatre for male and female patients. Sir has treated highest number of cases of mucormycosis, commonly known as black fungus in India. More than 1,500 cases have been treated successfully with use of Ayurveda medicines. Sir was also featured in BBC News for successfully treating these diseases. Sir has given standalone Ayurvedic treatment on the following diseases such as necrosis esophagus, left lobe pulmonary mucormycosis, blepharospasm, cholelithiasis, cervical canal stenosis, necrotizing wound, aspergillosis, and Ayurvedic management on complication of post-traumatic subarachnoid hemorrhage. Sir has also published total 8 case reports on above said diseases on Ayurveda Cell project, which is supported and funded by Ministry of Ayush. Sir is also a senior international consultant for Jiva Ayurveda Private Limited and also international panel of consultant in Easy Ayurveda Private Limited. Sir was also invited as a resource person for various lectures on clinical Ayurveda talk in many universities and different Ayurveda medical colleges in and around India. Sir's main area of interest are as follows: practicing Panchakarma, treating difficult cases like severe septicemia, cancer and autoimmune diseases, neurodegenerative disorders, various skin diseases, ENT and ophthalmology cases, stroke and its rehabilitation, infertility cases, muscle, bone, and joint diseases, rejuvenating therapy, and geriatric ailments, hormonal diseases. Sir has also treated critically ill patients who were admitted in ICU. With this brief introduction, I once again welcome you for today's session, sir. It's an immense pleasure to have you today with us, and platform is yours. Kindly take over the session, sir.
Thank you very much for this invitation to have a talk on role of Ayurveda on management of critical cases. Uh, we should begin now. Uh, Please start the slide
Yes, sir.
from first. From first slide. Yes. So today we will be speaking on management of critical cases in Ayurveda, where I will be sharing few of the successful stories or successful case which I have prepared with use of Ayurvedic medicine. Next, next please. Next slide please. So I highly believe that thousands of years of human observation and trial and error are always far more greater than the 6 months of lab experiments in the lab, red experiments in the lab. So we know that modern clinical trials and modern research or modern drug research are always conducted on the limited participant, maybe 1,000, 2,000, 10,000 people or few animal in the laboratory, and then they come to conclusion that this will work in all these things. For example, India is a country of 140 crore people, and some molecule will be developed based on the finding of just 10,000 or 20,000 people. But India is a 140 crore people's country, and I think it is very much difficult to implant those findings in the whole country level, where we have different ethnicity, we have different food, different culture, everything. So I think this is not going to help much more. But when we compare with Ayurveda, our Acharya has done all the trial and error on the larger scale of public, and whatever they felt it is the good or whatever the conclusion was there, that they have written in the form of Samhita. So we must respect our Samhita, and we also must need to follow the principle that is written in the this book. So here in this photograph, you can see two animal. One is a social animal, that is Usain Bolt. Another one is a cheetah. Okay. So before the Usain Bolt came into the pictures, whole world was thinking that cheetah is the only living being which can run fast on this earth. I repeat, before the presence of Usain Bolt, whole world was thinking that cheetah is the only fastest running animal on this earth. Okay, so that was the mentality of our people said before Usain Bolt, that cheetah is the only animal which can run fast. Okay, now Usain Bolt come, he started running more quickly. Okay, so that theory become not valid. That cheetah is the only one person which can run fast or which can walk fast. But after Usain Bolt come, that theory becomes wrong. Now after Usain Bolt started running, all people thought that oh, it was the only cheetah who is running fast. Now he is the also running fast. So many children and many other players started running even faster than the Usain Bolt. We can see in the internet there are many news that there are many children from African village, there are many from even Indian village. Those children are running more faster than Usain Bolt. So even that theory becomes wrong, that Usain Bolt can run faster than the cheetah. There are many. So our condition or our Ayurveda people's condition is like this only. We think that Ayurveda works only in the chronic disease. We think that Ayurveda is only for Amvata, Sandhivat, Pratishay, something like that. Ajirna, Agni Mandya, something like that. But we were not knowing that Ayurveda can actually work in the most critical and advanced stage of disease. Okay, so even when I started my practice, I was thinking that we have learned Ayurveda in college, and what we have learned is we should treat this disease, and apart from this disease which comes means we have to refer a patient, because this is not in our field to give a medicine to such patient. But then I have seen some Vaidya who were practicing beyond this limit. Then I thought, oh, they are also Ayurvedic doctor and they are treating challenging cases. We are also Ayurvedic doctor. Why not we start treating this such disease? So then we have started doing the treatment of such disease, and gradually we got success in majority of the cases. And in today's practice, most of my OPD is from critical or challenging cases only. So that theory becomes completely invalid, that Ayurveda can treat only this disease. For example, Amvata, Pratisha, Kushta, constipation, something like that. No. Cancer we can treat even life-threatening bacterial infection, life-threatening fungal infection, that can be easily treated with Ayurveda. Okay. So by this example, I just want to motivate the other students. They are like me, because I am also a student. Even today, I am a student of Ayurveda. I am daily learning new things from the patient and from the classical text. So to motivate all, that we should not make a line that this is the only area of practice of Ayurveda. Whole world belongs to us. We must try to develop new protocol. We must try to correlate the modern disease in our textbook and find the treatment and practically educate in the patient, and we get the good results. Next. Next slide, please. Next. Okay. So this is the first case I will be talking about. Please, before. Next slide, please. Okay. So this is the case of a 75-year-old male patient who came with a complaint of vomiting and abdominal pain for 4 to 5 days. And he went to the hospital, and there they have advised to go for upper GI scopy, and there they have found the patient is having large hiatus hernia and necrosis esophagus. So you can see the photograph of the patient, severity of the necrosis of the esophagus. You can see the whole esophagus muscular lining is completely necrosed, and this can get perforated at any point of time, and patient may collapse even in few seconds. So this is a critical case. Urgent surgery is required to remove the esophagus part which is necrosed, and to stitch the upper and lower normal part of the esophagus. But sorry, the patient came to Ayurveda. We have started treatment for this patient, and we have used only 3 medicine in this. One is Arboreum plus syrup. Second one is Nagarjunabra Ras. It has only Aprakasma, and Bhavana is given with Arjun Soras. And third, we have used Vruddhi Bhajika Vati. That is for Vruddhi Rog or Antho Vruddhi. That for large hiatus hernia. To improve the blood circulation, or we can say it as a Shiragat Vat, because the artery, vein, or arteriole, or venule, or capillary, all these 5 things comes under the Shira. So necrosis means tissue is not getting proper nourishment. So there is a problem in the Srotas. Srotas means artery, vein, venules, arterioles, and capillaries. So to correct this, to improve the circulation, I used Nagarjunabra Ras and Arboreum plus syrup. So after giving these 3 medicine for few days, patient started saying that he don't have pain, he don't have vomiting, even he is taking solid food, means he don't have any issue. So after I think 1.5 or 2 months later, we advise another scopy to see whether radiological improvement is there or not. We have advised another scopy. That we will see in the next slide. please. Next slide. Okay. So this is the after Ayurvedic treatment. You can see the esophagus lining is completely normal. Nobody can believe that the before photograph and after photograph are from same patient, because such an extensive necrosis of esophagus cannot be treated with even modern medicine. They don't have anything except surgery, and that too emergency surgery. But with Ayurveda, we have completely reversed the necrosis esophagus, and hernia is also become small, which was large hiatus hernia before Ayurvedic treatment. So here you can see, before you already saw the black esophagus was there, and after treatment you can see the whole esophagus is completely with healthy mucosa and fresh blood supply. Next. So next case is Mastishtha Janya Vayu Vruddhi, that we can say, or Mastishtha Janya Shiragat Vat, that we can say. So this is the case of high flow AV malformation of the brain. 41-year male patient came with complaint of severe giddiness, headache, and sometimes nausea since last 5 days. And the patient was chronic alcoholic, so continuous taking alcohol and going for vomiting continuously, which might have increased the intracranial pressure, and due to this the samprati have started generating there, and it got sthan samshraya in the shira of the mastika, or the blood vessels of the brain. Next. So this is the MRI scan of the same patient. In the impression, you can see the finding suggestive of high flow arteriovenous malformation. Next. So there is no treatment for arteriovenous malformation in conventional this system of medicine. They have only the surgical option, and that surgery is also high risk surgery, and only an experienced neurosurgeon will go for operating the case of AV malformation in the brain. So patient was admitted at our hospital for 7 days for Panchkarma, and after the 7 days of Panchkarma, at the time of discharge, there was 50 to 60% reduction in overall clinical complaint, that is giddiness, headache, and nausea. So he was discharged after 7 days of Panchkarma treatment, and till today he is living normal and symptom-free life with Ayurvedic medicine only. So this is, I think, about 1 year of follow-up we have taken. After that, we don't know what is the condition. But after the 1 year of our treatment, he was perfectly doing fine, and even he is not taking Ayurvedic medicine. He don't have headache, giddiness, or nausea, anything. Okay. So diagnosis we can do in this case is Shiragat Vayu or Mastishtha Janya Vayu Vruddhi, or it can be continued Mastishtha Janya Vayu Vruddhi or Shiragat Vayu, Mastishtha Weapon. So what treatment we have given? Prathamanasya with a powder of Panchamrut no Gugulu twice a day we have given in this patient. Matra Basti with Mahakalyana ghee. So Panchamrut no Gugulu, you all know that it is being given under the Mastishtha Rog Adhikar in Bhaishya Ratnavali. So in all the brain related disorder we use Panchamrut no Gugulu orally as well as in the form of Prathamanasya. Same at the time of discharge we have given Panchamrut no Gugulu, Mahakalyana ghee, Dhanadhanyadi Path, and Suvarna Mahayog. Here Dhanadhanyadi Path is best to be used where we want to reduce the intracranial pressure. So Dhanadhanyadi Path works extremely good when our goal in the treatment is to reduce the intracranial pressure. Next. So a role of Ayurveda in H1N1, that is the swine flu, in the patient who is on ventilator support. So this is the after second wave of COVID. In Surat we had so many cases of H1N1. So this lady was diagnosed with H1N1 and got admitted in the hospital, and in spite of all the treatment in the hospital, her lungs was completely damaged. It was gradually damaging in spite of having treatment. So finally she was put on the ventilator support, and on 5th day of ventilator, relative approach for Ayurvedic treatment. So they approached very late for Ayurvedic treatment actually. But then we have given the combination of Hirak Basma, Abrak Basma, Swaskar, Chintamani, Chosat Prahari, Pipali Churna, Pushkarmul Churna, Lavangadi Tal Sindur, every overly with Kapsura Kashay. We have given Pushkarmul Siddha Jal to be given in the hourly feeding through rice tube. Application of the Lepana, this thing, Dravya on the Pranavasurtas area. After fourth day of Ayurveda medicine, her chest X-ray showed significant improvement. O2 requirement came down, but still she was on ventilator support. And further after 2 days, another X-ray show another good improvement, but unfortunately she died after 4 days due to the cardiac failure. So here I have shared a case which died while taking Ayurvedic treatment and she was on ventilator support. So what is important here is timely approach of Ayurvedic treatment in extremely critical patient is very much important. If this patient would have started Ayurvedic treatment from the first day of ventilator or when she was in the general ward with diagnosed H1N1 case, we might have saved this patient. Anyhow, we have improved the function of Pranava Srotas, but due to the side effect or something from modern medicine or like that, she ended with cardiac failure and she died. Next. Next. Okay. So this is the X-ray of that lady with H1N1. You can see 15th July when she was in general ward ICU. Back. Previous slide, please. Okay. So 15th July, you can see the X-ray. Lungs is little bit visible. Even after giving treatment in the hospital on 19th July, you can see lungs is totally damaged, not at all clearly visible on the X-ray film. And from that day, Ayurvedic treatment was started on 20th July, that is next day of that 19th July X-ray. Then after 4 days of treatment, you can see the significant improvement in the X-ray. Another after 2 days of medicine, you can see more improvement in the X-ray. Lungs is almost visible, which you can compare with 15th July, not at all visible. This is the Ayurveda role in critical case management. The patient who is in ventilatory support, we can give Ayurvedic medicine and we can help with the faster and easy recovery. Next. Next slide, please. So next is another case of Pranava Srotas Vyadhi. So case of alveolar sarcoidosis. Sarcoidosis can happen at any part of the body, but mostly we see in the ladies it is a alveolar sarcoidosis. So 48-year female patient came with severe breathing difficulty, wet coughing, chest pain since last 8 years. It was since 8 years. She was not able to do her routine work like bathing, cleaning clothes, going to washroom because of breathing difficulty and oxygen saturation coming down. And of course, they will show to many different doctors in different city, but couldn't find positive this impact even after spending many lakhs rupees. Then they came to Ayurveda, and after 2 months of Ayurvedic treatment, there was a significant improvement both clinically as well as radiologically. Now after Ayurvedic treatment, she can now do her routine work and also her household activity without any disturbance. Next. Next, please. So this is the X-ray of that lady of alveolar sarcoidosis. You can see before Ayurvedic treatment, X-ray was completely blank. And after 2.5 months of treatment, you can see majority of the lungs area is clearly visible in the X-ray film. Next. So treatment we have given in this case is Kapha Shaman Chikitsa and to strengthen the Pranava Srotas through Rasayan Chikitsa. So Pushkar Mul Siddha Jal we have given. So Pushkar Mul Siddha Jal or the Dashmul Siddha Jal, it has to be given to the patient of Pranava Sroto Vyadhi, the Jirna Vyadhi or the chronic disorder of lungs or respiratory system. Patient should drink either Pushkar Mul Siddha Jal or Dashmul Siddha Jal. That reference we have from Samhita. Okay. So no normal water should be given to the chronic disorder of respiratory system. Rather than we should give Pushkarmal Siddha Jal or Dashamalu Siddha Jal. Then 64 Prahari Pippali Lavangadi Tal Sindhu Tamra Basma Avipattikar Churna Sitopaladi Churna with Tambul Patra Soras and receiving tablet. It contains Purna Chandrodhi. So Lavangadi Tal Sindhu is an amazing classical medicine which helps very much in the strengthening of the respiratory system at the alveolar level. We have used Lavangadi Tal Sindur in so many patients in the COVID, and in all the chronic lung disorder, we can use Lavangadi Tal Sindur. So it is actually classical medicine. No pharma company in whole country prepares it, but it is very easy to prepare Lavangadi Churna, Tal Sindur, and Bhavana with Lavangadi Quat Churna Quat. So it is from a Rastantra Sar and Siddha Prayog Sangra, a textbook. It is a very excellent formulation to be used in Pran versus Vyati. Next. Next, please. Okay, so Ayurveda and cardiac disease. So 44-year male patient came with severe breathlessness on exertion, blood in the vomiting, giddiness, severe chest pain, radiating towards the neck and left shoulder to whole left upper limb and feeling of heaviness in the chest since 12 days. So patient was from Madhya Pradesh, so they brought him to the Ahmedabad one private hospital. There it was diagnosed that he is having type 2 or type D aortic dissection. As it was a cardiac emergency, they have referred to the higher center at UN Mehta Institute of Cardiology and Research Center. So UN Mehta, this center is a highly reputed center in North India for cardiac disorder, and they actually do very good work for all the cardiac patients. So, but the disease was like that, so they have advised immediate surgery with a very poor prognosis, and even after or while doing surgery, it was a very poor prognosis. Even while doing surgery, patient may collapse on the table. So patient was not ready for operation as they were told very poor prognosis. And even if they do surgery and patient had a CA of tongue and lung metastasis 10 years ago, so they thought not to go for surgery and they have accepted that let's see whatever is happening. So they thought to take Ayurvedic medicine. Somebody referred them to our hospital. So that patient from Ahmedabad came to our hospital in the Surat in the ambulance, and immediately after arriving at our hospital, we have started Ayurvedic treatment. But before starting Ayurvedic treatment, we have explained them poor prognosis that this is already a critical case and only surgery is the option. And even if the surgery is they are doing, chances of death of patient is very much high, even if the surgery is done. So after explaining all the poor prognosis to their relatives in their language, once they are ready, we gave them consent form to sign. After they signed the consent form, we have started our Ayurvedic treatment. Next. Next, please. Next slide, please. Next slide, please. Okay. So after 10 days of Ayurveda treatment, patient was 100% clinically improved. He can now walk without any difficulty, and there was no pain in the chest, and also there is no heaviness in the chest. Okay. So in treatment, we have given Sandhani Mahakashai 10 tablets twice a day. That is a 30 tablet. That is 1 gram tablet. So we can say 30 gram of Sandhani Mahakashai in a day. Pushkar Mol Siddha and Pushkar Mol external application on the cardiac area. Hridrog Chintamani Ras 1 tablet twice a day, Shuddha Gugulu 2 gram twice a day, Nagarjuna Ras 9 to 10 tablets in a day, Hriday Basti with Dashimula Tail twice a day and Krishna Karni Kwath twice a day. So type 2 aortic dissection is nothing but a Bhagna taking place in the Shira or Dhamani. I repeat, Bhagna taking place in the Shira or Dhamani. We know Asti Bhagna, like that Bhagna can happen at any this thing in the body. So now the artery, one of the layer of artery is getting ruptured and whole blood from the aorta is getting collected in the artery itself, in the ruptured part. It is called type B aortic dissection. So with our yukti, we have to do Sandhana Karma in this case. So we have used Sandhani Mahakashai in an aggressive dose. Also to strengthen the Pranava Srotas, we have used Pushkarmul Siddha Jal, Hridrog Chintamani Ras. In case any avran is there, to clear the avran, we have given Shuddha Gugulu and Hridaygat Vat means Krishna Parni Vat we have given. And to locally reduce the Vata, we have given the Hriday Basti with Dashmul twice a day. Next. So this is the case report of that patient. You can see the UN Mehta Institute of Cardiology and Research Center, which says a patient is having type 2 aortic dissection, concentrated left ventricular hypertrophy, mild TR, mild PH, normal left ventricular size, and fair LV systolic function. So in the yellow arrow mark, you can see the aorta is ruptured and whole blood is getting filled in the pouch. That pouch is abnormal structure which is created due to the Bhagna in the Shira or Dhamani. All the arrow you can see, that is abnormal structure. Okay, next. Next. Okay, so this is the X-ray of the same patient. 24 April, you can see the cardiomyopathy or cardiomegaly or anything. You can see that side lungs is not at all visible. Very few part is little visible. Sorry. So after 10 days of Ayurvedic treatment, you can see the lungs. We can see the improvement in the radiological this thing. Lungs is visible very much clear compared to 10 days before X-ray in the cardiac emergency. Next. Next, please. So this is the how. This is the place of Ayurveda. So all the hospital in India should include Ayurveda in their ICU treatment through a qualified Ayurveda physician. So here you can see first one is the patient of COVID this thing infection admitted in the hospital with ventilator this support. And mostly we do Lepan Karma more in the ICU because giving oral medicine every time is not possible. So externally we try more to application of the medicine of the herbs on the this thing. We used to apply in the COVID Pushkarmul, Vacha, Punarnava, Haridra, Karkat Sungi, Shati, all these things, Vasa that we used to apply on the this thing. In the second photograph, that boy is hypoxic brain injury and he was in coma, and they didn't took long treatment, so I can't share the results how it was responded. But we use the same Lepana Karma on the brain. There we use Vacha, Brahmi, bamboo leaf, all these things. Yeah, this Jyotishmati, everything that we used in the Mastishka journey of this thing. Next. So Ayurveda and necrotizing wound. So large non-healing and necrotizing wound is getting healed with Ayurvedic treatment in just 20 days of Ayurvedic treatment. And the wound is now full with fresh blood supply and healthy tissue growth is there. Next. So here you can see the photographs of the patient. Uh, Day one, you can see the wound. I think the wound was this much size in the waist, stomach area. So this much size wound was there. And after doing the debridement and the soft tissue removed and first pocket opened, you can see the progress. This thing, photo-wise progress. Coming down, you can see the in the fourth photo in the upper row, fresh blood circulation was started. Tissue is more pink or reddish than the white or yellowish. In second row, you can see the complete healthy granulation, healthy tissue is there. And in the first photograph in the second row, you can see Brand Dhupan that we do in Brand Chikitsa. So first we do Vrana Prakshalan with control color path. After doing Vrana Prakshalan, we give Dhupana with Krumigna and Vishagna Dravya. That is Palash, Shirish, Bidam, Khadir, or sometimes we put Shuddha Hartal or Shuddha Manasil in the Dhupan. And we give the Dhupan to that specific area to prevent the sepsis or any infection and to promote the healing. Next. So this is the conclusion. Before treatment, this was the wound, and after 2 months of Ayurvedic treatment, 95% were completely healed, and by today, it is not at all any scar is there. Next. So at the time of admission, dead tissue were removed and all the pus pockets were opened and pus were taken out. Then we had given wash with consultal path, then Ran Dhupana with Neem, Vide, Bidam, Khadir, Shirish, Tripala, Shuddha Hartal, Shuddha Manashil can be done. Then after Ran Dhupan, we used to apply WH5 ointment on the Prana Pradesha, Prana Sthana. And after 7 days, same thing, they used to repeat 3 times a day in the home, at the home. So oral medicine, Kaishwar Gugulu, Shirisa Panchanga ghee, Vyadhi Arandars, Shiva Gulika, boiled moong or water. So this was the medicine given. Vyadhi Arandars is again a classical medicine from Rastantra Sar and Chitta Prayog Sangra. The classical indication or the falsity of Vyadhi Arandars is Astigat Vish, Nadi Vran and Drushtavran and also Firangu. So to prevent the infection invasion to the bone, because bone was very nearby structure and this much wound means osteomyelitis chances are very much high. So we have used Vyadhi Arandras so for that, and also it is indicated for Ron. Shirish Panchanga ghee, it is from Tarak Chikitsa Vish Chikitsa Adhyay. Any wish can be neutralized with the help of Shirish Panchanga ghee. Even a snake bite, we can treat with Shirish Panchanga ghee. So the purpose of use of Shirish Panchanga ghee in this case is to prevent the secondary infection or to prevent the septicemia, because this patient was already having blood pressure and diabetes and she was taking a huge amount of medicine daily. So chances are very much high for the diabetic patient that she may end up with severe septicemia or septic shock. So unfortunately nothing happened, but we have used this medicine. Next. Next, please. Ayurveda and osteomyelitis. 42-year female patient came with complaint of upper palate swelling, bleeding gums, pus discharge from swollen gums, foul smell, loosened teeth in affected part, and heaviness of the face. She was having a history that she visited a dentist before 10 days for teeth removal. Sorry. So it is a Abhigata Vayu Vruddhi, and due to Abhigata Vayu Vruddhi, a stick Kshay was there. Next. Next, please. So CBCT scan of this patient suggested that this lady either has squamous cell carcinoma of left maxillary sinus or she might have osteomyelitis, or she might have necrosis. Now, to confirm this, they need to do a major surgery and to remove the affected part and to send for a biopsy to check whether it is a cancer or it is osteomyelitis or it is a fungal infection. So I say to them that don't go for operation, just take medicine, my medicine for 15 days, and if there is no satisfactory result, then we can go for biopsy first. What direct major surgery and then biopsy. So they were ready to take medicine for 15 days, then we will see. So they took 15 days medicine and amazing improvement was there. So operation, I said now no need to do operation. We will continue our Ayurvedic medicine. Same. Next.
Sorry for the inconvenience, sir. There is a network issue here. So there is a lag in changing the slides, sir.
No, no issue. It's okay. No problem. So in this case, following medicine were used, and it was not used at a time. It means in a one day we don't give this whole medicine, but in whole treatment course, these are the medicine that we have used in the oral this maxillary osteomyelitis case. That is Shuddha Ballatak Churna, Bilvadi Gulika. Now Shuddha Ballatak Churna for kapha or Kledanashan, Bilvadi Gulika to tackle any Visha effect is there because they will give local anesthesia. They will use some metal material to do operation hole and everything. So it acts as a Garvish or Dushivish. Seven Kotai capsule again it has Ballatak to do a clay and cough nasal. Trifala Gugulu, Panchatikta ghee, अस्थिवर स्रोतो दुष्टि means पंचतिक्त द्रव्य we have to use in the form of basti, pancharma or orally ghee. So we have used Khadiradi Vati, Bhadra Mustadi Churna, Sandhani Mahakashai that we have used. Bone tablet we have used. So Sandhani Mahakashai to do the Sandhana karma of necrosis or osteomyelitis bone to generate new bone. Bhadra Mustadi Churna is from Vaishya Ratnavali, Mukh Rog Chikitsa. Under the Mukh Rog Chikitsa, Danta Rog Chikitsa, Bhadra Mustadi Churna reference is there. Musta, Neem, Bidang, 6 ingredients are there. It is very excellent churna. We can advise to the patient those teeth is doable. Continuous they do toothbrush with this means within few days teeth will become immobile. It will restore the mobility. Next. Next, please. Next. So Panchtikta ghee, I think I have explained all the this thing reason behind why we have used this, and in this also we can use the Vyadhiharan Ras we have used here. So Vyadhiharan Ras again to remove the Visha effect in the Asti Dhatu we have used. Next. So these are not medicine used at a time. For example, when there is a Pitta Prakopa or active bleeding is there, we don't use Ballatak Churna or Ballatak preparation. Same with the Vyadhiharan Ras, we don't use when there is a active this thing bleeding or something like that is there.
Sir, 1 second, sir.
No problem. Here you can see the before treatment. You can see the one teeth is removed, and in that swelling and inflammation, everything is there. Another view of the same patient, you can see the white this tumor, something like that. It is there. The first discharge is there with very foul bad smell. You can see before treatment, while treatment, you can see redness, inflammation is getting down after while treatment. And latest image in the last first photograph in the second row, you can see oral cavity is completely almost normal. Next. So here you can see the radiological evidence of new bone formation in the osteomyelitis with an Ayurvedic treatment. So you can see the arrow mark in the first photo, the black area which shows there is a no bone because bone was lost due to the necrosis due to osteomyelitis. So there is a no bone. Normally yellow color bone should be generated in that film because now because there is no bone, the rays is passing throughout the this thing. So in the film there is no bone, means bone was lost due to the necrosis and osteomyelitis. Same in the second photograph, you can see the round black this thing bone loss is there. After Ayurvedic treatment, you can see the new bone formation is there in the third photo. In the fourth photo, you can see that area is completely now filled with a new bone. So this is the evidence that in the case of necrosis of bone or osteomyelitis necrosis, we can generate a bone, completely healthy bone. Next. Same thing. Next. So I have then intestinal obstruction. So but the good order. Next. So we all know that any kind of a gut obstruction is always a critical or the emergency or the immediate or as soon as possible surgery is required. So 68-year female patient came with complaint of unable to pass the stool, abdomen pain and heaviness, weakness. CT abdomen on 21st January show possibility of acute small bowel obstruction with the average diameter of 3.4 to 3.6 centimeter and possibility of underlying stricture of adhesion formation. Now on 5th of February, it turns into the subacute intestinal obstruction with maximum caliber of 3.1 centimeter. Next. So in the treatment, we have given classical basti, Anuvasan basti, we have given with Gandharva Stadi Heran Tel. Because Gandharva Stadi Heran Tel is classically indicated for a Vruddhi in Bhaishaj Ratnavali. In Niru Basti, we have used Makshikam, Lavanam, Snake, we use Gandharva, Gandharvastadi Herantil, Kalka, we have used Shadharan Churna Kalka, Quath, we have used Balamul, Ashwagandha, and Eranmul, and with Gomutra Ark. So Acharya Charaka has advised to give Tikshna Basti with Gomutra in Vruddhi or Baddha Gudodar or this kind of disease where the obstruction is there. So we have added Gomutra Ark in the Niru Basti. Along with Basti, we have also did Dhanyamla Dhara and Upna Swed in the lower abdomen with erand seed, Mukta, that is March, that is black gram seed, Dhanyamla, Bala, Ashwagandha, Eranmul, Gandharvastadi, Erantel, and application of the bandage with Erandapatra or Arkapatra. Next. So this is the report of the lady of intestinal obstruction on 5th of February. As I said, subacute intestinal obstruction was there, which is the perfect candidate for OT surgery. After Ayurvedic treatment, you can see there is no evidence of significant bowel wall thickening or dilatation at the present study. So this structural damage or the structural deformity was completely restored with the help of classical Basti, Dhanyamla Dhara, Upna Swed and oral medicine. Next. Next. Can you play this video? Uh, Video is there in previous slide. If possible, you can play the video. No, in previous slide. This is a video. You click on the video. Is it playing?
Sir, it's not coming, sir.
Okay, no problem. Next. So this video I have kept about Dhanyamla Dhara and Upna Swed on the abdomen area for the intestinal obstruction patient. Okay, no problem. So Ayurveda and spider bite, Lutavish. So in the photograph you can see a spider. It is this big spider, and you can see a thorn on his leg. If you can see clearly, you can find little bit thorns on his leg. So it is like a picture-like story for this case that we'll see next. So 23-year-old male patient came with a complaint of hard swelling on the right arm area, burning sensation, hard to touch area with pain, reddish discoloration of the affected part. It is a Jal Sadrush appearance since 1 week. Patient was operated for the same condition in the same hand at a different site, but it is now reoccurred for third time, and patient had exact same clinical presentation in the past for the 2 times and operated also. Now it is for third time, so he came back again, come to Ayurveda rather than going to the surgery for third time. Next. So, the 13th of February, MRI showed that forearm cellulitis with subcutaneous infective collection on dorsal aspect. For this, surgery was done after 2 days, that is 15th of February. Then again on 22nd March, MRI was done which shows subcutaneous edema, inflammatory fluid involving deep subcutaneous plane of forearm region, particularly along with osteomyelitis aspect. Now for again, second surgery was done after 3 days of the scan, that is 25th of March. So first surgery was done on 15th of February, second was done on 25th of March for the same presentation. Second time come, now after second surgery, now it has come for third time on in the same hand. Next. So now the same symptoms are again reoccurred at the right arm since 7 days. Patient came for Ayurveda treatment and he doesn't want surgery for the third time. Modern doctor tried to find out the cause, but they couldn't find any cause for this issue. But the surgeon has an opinion that the dead tissue under the skin is clearly resembling like a case of any insect bite. So they were not sure whether it is due to spider bite or something else. But when they opened this thing or damaged part of the fascia, what surgeon has found that the collection which was collected, it mostly it is seen in the insect bite or any poisonous animal or something bites, means this kind of collection will be there. Now the interesting point here is that the patient had seen a big size spider with thorn on his leg in his shop. But he is also not sure that this spider has bitten him or not. That spider is not known to be present in the Gujarat state. And the chances are there that this spider would have come from the China in the container from where he ordered material for his work. He works in the clothes and embroidery work, so he ordered material from the China. The spider would have come from China in the container to here, and while shifting the cloth or the material, he might have lifted that bunch of that cloth, and the spider might have touched somewhere here, or he might have this thing. His thorn might have gone deep inside the skin, and from there it has started. Next. So based on this finding, we have started treatment of this patient under the protocol of Lutavish Chikitsa from Charak Samhita, and after 7 days of treatment, whole lesion and all the symptoms were completely disappeared. See, very beautiful. You will fall in love with Ayurveda with this. 2 times he had an operation, They have spent much money. First they did operation. After few days again it came. Second time they did operation, but Prakruti Sthapana was not done. So Vyadhi will reoccur compulsory. So third time it came and patient came to Ayurveda, and with Ayurveda just in 7 days completely everything was disappeared. So we must fall in love with Ayurveda to treat this kind of disease, and very easy to treat if we read Samhita. Next. So treatment was selected from T2 Vish Chikitsa and General Vish Chikitsa from Charak Chikitsa. So Panchashirish ghee that we prepared and we have in our hospital we use for such cases. So 1 tablespoon thrice a day we have given. Shotanda Mahakashai tablet 5 tablets thrice a day. Vishagna Mahakashai 5 tablets thrice a day. Kaishol Gugulu 2 tablets twice a day. Rishi Vishari Gulika around 10 tablets in a day. Shirish Pushpa Swaras 1 tablespoon every 2 hourly. Dhupan with Tagaru Push Shirish 3 or 4 times a day on the hand. And after Dhupana application of paste prepared of Rakta Chandan, Shirish Beej, Nilgundi, Idarikan, Tagar, Push, Patala and Anantmul. And the fresh paste was prepared with the Swaras of Sneshmata Patra. So this is a highly aggressive dose that we don't give for daily, but initially few days we give highly aggressive dose to see the quick results, then we reduce the dose. Otherwise what happens if we fail to give a results in this type of case in 2 or 3 days, patient will go to surgery, or we cannot take a risk that we will change the medicine after 4 to 5 days if we don't see the results. We cannot give 4 to 5 days of time in such cases, then disease will progress. So we need to be very aggressive in the treatment in the dose when we are dealing with critical cases. So the dose is highly aggressive. Next. So you can see the photograph 24/4/2023. This area was completely stone like this thing, completely warm but very hard. Dal Sadrush Rekha, something spider, this light you can see. Second day of treatment itself, he has a warmth, Ushna Spurs was reduced and Shoth was also reduced. On 26th, just after 2 days of treatment, you can see the swelling is reduced, the reddish discoloration is reduced. Next. So you can see the whole this thing is completely disappeared, everything without operation until now. And after 10 to 15 days, he hasn't taken even Ayurvedic medicine, and he don't have anything now. This is the beauty of Ayurveda. Next. So this is just the X-ray of one patient with malignant pleural effusion. You can see the adenocarcinoma of lower lobe of I think the right or lung. You can see the pleural effusion after Ayurvedic medicine, and after doing Lepana with Pushkarmol, Punatava, Bacha, Shakti and Karpatsungi on the chest area, you can see the reduction in the pleural effusion of this thing. Next. So Ayurveda and hemolytic uremic syndrome. Again, this is a critical this thing. Patient needs to get admitted in the hospital urgently, and plasma therapy, hemodialysis is the must start treatment for such cases. So 29-year female patient, she has a history that on 10th March 22 she got a high fever with rigors. So she went to a general practitioner and they started treatment. After starting treatment, orange color urine was started, and so she was admitted in the hospital. And there, after admitting her, the blood report says her hemoglobin is almost fall to 3%, and platelet is 25,000, and serum creatinine was 3.5. So based on these parameters, they have diagnosed this case as hemolytic uremic syndrome. So to recover this patient, dialysis and the plasma therapy is the only option in majority of the cases. So 8 sitting of dialysis and 6 plasma therapy was done and she was perfectly fine and they discharged. Now after few days again orange color urine she has started. Okay. So at this time they thought to take alternative treatment. So her family physician referred to our hospital for Ayurvedic treatment. And after 2 months of Ayurvedic treatment, her HB level and platelet are in normal range. So creatinine was around 3.5 and it remains around 1.3, and platelet count was also at the normal range and there is no clinical sign and she is doing her day-to-day routine activity normally. Next. So here you can see the Ayurvedic medicine's response in the hemolytic uremic syndrome. So hemoglobin was fluctuating from 7. It was fluctuating from 7 to 8 or 8.5. There was no upside more than 8. It was not going. Okay. So at the time of Ayurvedic treatment, she came. Her HB was 7.8 already because she has 2 or 3 days history of orange color urine. So after we have started Ayurvedic treatment, when we stopped the Ayurvedic treatment, her HB was 12.7. That is almost near to the normal. Next. So platelet count was also fluctuating between 80,000. One time it went above 1 lakh, but it was fluctuating between 80 to 90,000. So after Ayurvedic treatment, we have successfully recovered a platelet count up to 2,11,000. Next. So how to apply Yukti for Chikitsa of such cases? So in this case, understanding of the disease was done with the help of modern pathogenesis and treatment was done on the basis of Vish Chikitsa. Now, if we would have started the treatment of this case as Adhoga Rakta Pitta, we might have got the temporary results. Okay. But unless and until we don't clear the Vish from the renal system or we don't remove the Visha Prabhava from the Mutra Srotas, then it is difficult to restore the Prakruti, or it is difficult to do the Prakruti Sthapana in this case. So I take a help of modern pathology. I understand modern pathology, what hemolytic uremic syndrome is. Then I compare it with the principle of Ayurveda and start treatment of Vish Chikitsa in this case. Next. So this was the pathogenesis of hemolytic uremic syndrome. Why this happens? So in some case, E. coli bacteria produce toxin called Shiga toxins in the blood. So when contaminated food is taken by a person, the E. coli bacteria will produce the specific toxin called Shiga toxins in the blood. In your body, there will be GB3 receptor which will be more in the renal tissue compared to the other body parts. And this Shiga toxins bind with GB3 receptor. So with contamination, food goes inside in the intestine or in the blood flora. Shiga toxins will be released. It will be absorbed in the blood. It will circulate in the body, and it has the tendency to bind with GB3 receptor in the body. There are many different tissue in the body. In brain it is there, heart it is there, muscles it is there, kidney it is there. But more GB3 receptor will be there in the renal circulation or renal system. So these Shiga toxins will bind with GB3 receptors. This leads to the activation and deactivation of a blood clotting mechanism factor. It will do the impairment. It will cause impaired function in the blood clotting mechanism. So this leads to the too much breakdown of the platelet which is passing through the renal system in the glomeruli. Okay. So this leads to the acute kidney failure. Simple. So what we understand through this modern pathogenesis is the Shiga toxins is the main culprit of this disease. If we want to gain the good results in this treatment, we must need to neutralize the Shiga toxins. So that is nothing but Vish Chikitsa we have to do. We can either choose Pakvashagat Vish, Amashagat Vish, or general Vish Chikitsa we can apply in this. Next. So simple medicine we have used, Shirish Churna we have used, Bilwadi Gulika, Nagarjunabra Ras and Basti Amayantika group ghee. So Shirish we know, Shirish Vishagnanam. So it is the best anti-poisonous this thing. Bilwadi Gulika we all know it is for Vish Chikitsa. Nagarjunabra Ras it has got Abrak Basma and Arjun Bhavana was given. So in all the autoimmune disease, cancer and wherever we feel that cell is confused or the cell is not doing their proper work, we can use Abrak Basma. Because Abrak Basma has a best quality called Pragnya Bodhi, which is from Rasratna Samuchay. So Abrak Basma will order the cell to do his normal activity and he will instruct them not to do the abnormal activity in the autoimmune disease and in cancer. And we have used Basti Amayantika Gruta also in this case, considering it as a Bastigat dosh. Next. Eye disease. 60-year male patient came with complaint of severe pus discharge, which was sticky and white in color from the right eye since 30 days with redness, pain and loss of vision. So bacterial and fungal culture was done from corneal discharge and it was found that there is a heavy growth of Streptococcus pneumoniae, that is gram positive, and no fungal element was seen. So patient had taken both oral and IV antibiotic and also oral antifungal as well as antifungal eye drop, but he was not at all responding to the treatment. So the ophthalmic surgeon has advised to remove the whole affected eyes immediately to prevent further spread of infection into the brain. To prevent the cerebral invasion, they have to remove the eye. That's what they have explained to the patient. So it is natural, nobody will directly go and remove the eye. They will ask for any other option or any other alternative option is available. So somebody referred them to our hospital and we have given treatment for 45 days, and after 45 days of treatment, significant clinical improvement was there. First discharge was almost reduced, no pain, no redness in the eye is also then reduced. Now the interesting thing is after this treatment, I have sent them to go to ophthalmic surgeon and have their opinion. So he told that now it doesn't look like that you need to remove the eye or surgery is not required. So they asked what you did. So patient told I am taking Ayurvedic medicine. So he told you continue whatever Ayurvedic medicine you are taking. Now no need to remove the eye. Next. Here also the video of patient's eye is there, but unfortunately due to some technical error we are not able to see here. So in this case we have used Netra Sudarshan as a eye drop and Stri Stanya as a eye drop. Gandhaka Bhrungraj Vati, it has Gandhak and Bhrungraj. I mean Gandhaka is given a Bhavana with a Bhrungraj Swarasa for 7 times, that is Gandhak Bhrungraj Vati. Drupana with Khadir, Vidang and Shirish on the eye twice a day, Pancha Shirish ghee. Vidang and Khadir Siddha Jal, Amrut Dallata Kaule, Shuddha Bubulu and Rumigna Vatika. As it was a clear case of sepsis, eye septicemia. So we have did Vish Chikitsa. Next. So again I strongly believe and I strongly urge all to believe this that thousands of years of human observation and trial and error are always far more greater than the 6 months of red experiments in the lab. So we must respect our Samhita and our Shastra. It doesn't. It is not like that. This disease is not explained in Ayurveda, so we should not do the treatment of this disease, or we should not get fear of some large, big disease, or when we see MRI impression, one long paper with Ayurveda, we cannot do this. This is not in our field. at least we should start studying this thing. Later you do treatment, but at least if we start studying those diseases in terms of Ayurveda, one day we will be able to treat those so-called challenging cases with Ayurveda successfully. So again, I say we must read Samhita on daily basis. So that was the few cases I wanted to discuss with you. I would like to thanks Dr. Siddharama sir for inviting me to talk my experience for the treatment of this disease, and I also thanks all the team who are behind this in arranging this webinar, students of postgraduate, and I also thank principal and HOD madam for giving me opportunity to speak on this platform. Thank you very much.
Video ಬೇಡ ಬಿಡು. Voice. Thank you, sir. Critical care management in Ayurveda is the need of the hour. Sir has excellently described this in today's session by highlighting the points like role of Ayurveda in management of H1N1, cardiac disease, necrotizing wound, osteomyelitis, Lutavisha, Baddagudodara, and hemolytic uremic syndrome with successfully clinically treated cases. This was a wonderful session, sir. We are really grateful for the knowledge you have shared with us. Now the session. Now the session is open for discussion, sir. Here there are some questions posted in the comment box, sir. Shall we discuss that
Yes, no problem.
question? Okay, sir.
Yes, you can take a means you can ask question. I will reply.
Yes. Sir, what is the emergency management in hematemesis? Question, sir.
See, first we should at least have little bit history of patient. For example, what if some reports is available, then we should go for this before starting Ayurvedic treatment, because we should not end up in some legal this issue. So whether patient is having some esophageal CA, the patient is of liver cirrhosis, due to liver cirrhosis, esophageal varices is ruptured, and due to this blood vomiting is there. If some data is there, means we should ask first, and then we should proceed for Ayurveda treatment. Okay. So if patient doesn't have any data and first time he is experiencing this, then we can give this Shonitalgal Ras. We can make a powder of Shonitalgal Ras, 10 to 15 tablets, and ask a patient to put it in the mouth and don't swallow it at a time. Mix it with saliva, and little by little, they can swallow it. Then we have a Nandari Sharbat. I think it is a Siddha medicine, but it is a Sharbat of Saliva. If a patient is non-diabetic, then we can give this Saliva Sharbat to drink, and sip by sip they have to this thing. But again, once it is in control, we must find a cause of it, and accordingly we should do treatment. Because if it is due to the esophageal varices rupture, it is not going to stop. Okay, so for this they have to do the bandage through the scope on the esophageal this vein. Yes. Next question.
Sir, please explain what is 64 Prahari Pippali, sir.
It is actually a classical medicine. So Pippali Churna has to be taken, and Bhavana of Pippali Churna, Pippali Kvath. It means decoction is prepared from Pippali Churna, and with this decoction we have to give Bhavana to the Pippali Churna for 64 Prahar. So this becomes advanced state of highly potent Pippali. So this we can use even 100 mg or 200 mg people we use means we will get 10 gram of people results. Yes. Next.
So suggest a Samhita or book from where we can get knowledge of incurable disease by Ayurvedas.
It is the same. What you study and I study same. It is Tarak Samhita, Sushruta Samhita, Ashtang Hridaya. We have some reference in Kashyap Samhita also. Lagutri also, Bhav Prakash, Kashyap, Madhav Nidan is also very much important to understand the diagnostic criteria or to say this is more in detail about Lakshana. So I think there is no single book, but we should read only classical book like Charak, Sushrut, Bhagavad and all other in Ras Shastra. There are so many books. Rasratna Samuchay is there, Ras Tarangini, Rasajal Nidhi. So all the classical book we should read daily.
Sir, please explain difference between the understanding and treatment of infarct and hemorrhagic stroke through Ayurveda.
See, generally the symptoms of these two will be almost similar, clinical presentation. So Vatavyadi general treatment we can do, but if Basti if given in the very beginning type of stroke or infarct, for example today or to means within a 7 to 10 days, if you get a chance to give a classical Yog Dasti in the patient, then chances of complete muscle strength and everything regaining is completely there. Okay. When hemorrhagic stroke is there, so hemorrhagic stroke means Sodita Sanghat we have to do. There is a hemorrhage and it is clot will be there. So Shonit Sanghat we use Paravat Chakrut, sometimes we give Shuddha Ballata, sometimes we give high dose of Shilajatu or Upulu by considering it as a auran. And in infra, same similar Vatavyadi Chikitsa we can give, but no need to give this potent medicine in the infra. Or it can be taken as Shiragat Vayu. So in general, Vata Chikitsa will be can give very good results in both type of this stroke, infract or hemorrhagic.
Sir, emergency management of asthma.
Emergency management of asthma. Kanakasava high dose we can give, but if anybody has experience, then only they should try with high dose of Kanakasava because it may have adverse this reaction also. Sometimes we give high dose of Kanakasava. Swas Kuthar Ras Pradhamanasya we give. Also Pradhamanasya will help in this. And Pushkarmul Siddha Jal, we ask patient to drink all the day. So I think there won't be a major trouble in the emergency attack of asthma. Even external application of any oil, if nothing or no oil is available, just use whatever oil is available in the kitchen. Just make it warm, do a abhyanga and local steam. It will reduce the intensity of this thing.
Sir, any inputs for chronic?
Sorry. Sorry, I
Any
didn't.
inputs for kidney disease? Yes. Any inputs for chronic kidney disease patient undergoing dialysis twice per week?
See, in kidney disease or renal system chronic disease, whether bladder, kidney, ureter, we consider it as a Medavaha Sruta. So, Medapachak Yog we give Vastiamantic Kruta is there, that Vastigata dose we can use through consumer part, but there is no one treatment that we can fix for a chronic kidney failure, because some kidney failure patient have normal urine output, some kidney patient have chronic kidney failure patient not even passing single drop of urine, some is having different this associated complication. So treatment will be vary based on the which dose or which dhatu is more involved. We fix the treatment. So I think it is difficult to answer a specific this thing for this disease.
We would like to hear more about Samprapti Vigatana with background of modern biochemistry, because patients approach with lot of investigations which might deviate us to understand the pathologies.
See, that is what I told. We should not fall in the trap of modern diagnosis, or we should not get a fear by hearing their diagnostic term. They have some two sentence diagnosis. For example, I tell you there is a Melas syndrome, MELAS, Melas syndrome. So it is a mitochondrial encephalopathy like uh, lactic acidosis and stroke-like symptoms. So this is the one disease. Now, if a student of Ayurveda will know this disease first time, means he will know this much a big disease. But it is a simple Pitta Prakopa. So Pitta Shamana is done in Melas syndrome, means we get a good result. Simple. So, for example, I given an example of hemolytic uremic syndrome. So, when we read the modern theory that it says that E. coli bacteria release the cigar toxins in the gut and it goes to the blood circulation, it will bind into the GB2 receptor in the kidney, which impact the blood clotting mechanism, and thus it does the breakdown of hemoglobin, platelet, everything which comes into the circulation. So the cause in this modern pathogenesis is cigar toxins. So that is nothing but Vish Chikitsa. So we did Vish Chikitsa. So yeah, easy to identify in any cases. Now, when we want to see the dhatu wise, so we first know that dhatu produces vikara we all must know. For example, rasa dhatu produces vikara, how many are there and what and all are there. Rakta dhatu produces vikara. Like that, up to shukra dhatu produces vikara is there in Sutrastan in third Samhita, I think 28th chapter. So if we just look at that, we can understand which dhatu is involved in this case, which dose is involved, or which Srotas is involved. Then based on that Srotas basic treatment protocol, we can start treatment. For example, Astiva Sroto Dusti is there. Then Astiva Sroto Dusti Chikitsa, what they that in Astiva Sroto Dusti we have to use Panchatiktapa, Kshirabasti, or घी सिद्ध from Panchatikta or Panchakarma. So simple. So now any disease where we see the Asti Dhatu is involved, maybe there we have to use Panchatikta Dravya. Now in rheumatoid arthritis also you can use Panchatikta Dravya. In bone cancer also you can use Panchatikta Dravya. In bone marrow cancer also you can use Panchatikta Dravya. So like this I think we have to go. We should, our mind should not get deviated with this modern fancy terms. Okay.
Management of migraine in pregnancy, sir.
See, migraine is nothing but amlapit. I think the person who has asked this question, I advise him or her to read Amla Pitta in the Madhav Nidan. So you will see the Lakshana of Amla Pitta described in Madhav Nidana is exactly similar to that of migraine. So Pitta Shaman Chikitsa done means you won't have more migraine attack. So based on your patient, what Lakshana you have more, and you can start doing Pitta Shamak treatment, because migraine is nothing but a Amla Pitta. For more, you can see in the Madhav Nidan. Next.
Sir, can you just brief about the management of burns?
Sorry.
Can you just brief about the management of burns, sir?
The management of burns cell with Brahma we can start treatment, but in the initial days we should use aggressive Pitta Shamaka Dravya. For example, Shatadhauta Guta, this application. Any Pitta Shamak oral medicine, you can give Praval Yukta Gulkan, we can give orally, or if patient is having Ajina, then we can induce the Virechana to reduce the Pitta. So then we can use any Pitta Shamak Dravya. Main we use externally is a Shatadhauta group. We use more thick layer of Shatadhauta group. We do the application more.
Please brief about the diabetic ketoacidosis, sir.
Ketoacidosis, as far I haven't got any patient who I didn't got opportunity to treat the case of diabetic ketoacidosis. But as I told, we should make a classification of symptoms. For example, what are the main symptoms of diabetic ketoacidosis? Okay. Then you see what pitta or cough. For example, 5 symptoms are there. Main diabetic ketoacidosis. You select whether highly it is coming in vata, pitta, or kapha. So like that, I think anybody can select this thing. And I advise all these doctors that don't run for the medicine name, run for the principle. Because, for example, I have shared the case and I have told the medicine name also. But it doesn't mean the same medicine if you use in the same case, results won't be there. So better we should learn about those dhatu, srotas, everything in detail. Then only it will be easy for the anyone to treat any case. So here somebody has asked antibiotic resistance. So Suvarna is the concrete answer for all kind of resistance, whether it is a bacterial antibiotic resistance, antiviral resistance, or antifungal resistance. So Suvarna Bhasma or any Suvarna preparation is the drug of choice when we see any patient with resistance of either antibiotic or antifungal or antiviral.
Sir, how to approach autoimmunity through Ayurveda?
See, I already explained in one of the case. See, autoimmunity means again we have to see those dhatu like that. Autoimmune means where? Autoimmune this is where? Whether it is in brain, whether it is multiple sclerosis, treatment is different. Autoimmune skin disease, different is treatment. Autoimmune arthritis, treatment is different. So based on the Srotas involvement, you do the treatment, but use of Abrak Basma is compulsory in all the autoimmune disorder, because Abrak Basma will remind the cell what is their normal work. They should not kill the normal cell of the body. They should only kill the non-useful or enemy cell of the body. So that is autoimmunity. Body target our own cells. So Abrak Basma we give in autoimmune means won't allow body to kill our own cell. So that is the I think best treatment. Abrak Basma used in autoimmune disease. In pancreatitis, we use application of lepana on the this area, Nabi area, surrounding area. with Sharpunkha, Bhumi Amlaki. If pure fresh Sharpunkha is available, it is best. Otherwise, Sharpunkha and Bhumi Amlaki left we advise. And only boiled moong water and all these things only we give. And also to do the Pitta Shamana, Sutchekaras, Shatavari, Amlaki, or Nag Kesar Chuna, this can be used. Okay, any more question?
Sir, this is the last question, sir. Could you please explain Ayurvedic management for acute GE, sir?
GE? What is GE?
Gastroenteritis, sir.
Oh, gastroenteritis. It is the original treatment you have to do. Also, mostly the this thing will happen after some contaminated food injection, some roadside food or something like that. So again, when we have such cases, we give Vish Chikitsa like Shirisha Siddhajal, Dushi Vichari Gulika, Bilvadi Gulika, like that. Because it is the response shown by the blood flora or by the Mahashrotas or this thing, Mahashrotas, Annavashrotas to the foreign thing which is not suitable for the body. So that is Vish Chikitsa. Or gastroenteritis can be taken up as Amashay Vish or Papashay Vish. So that is the symptoms we see. So Vish Chikitsa, Rishi Vichari, Vilvadi, Shirish, Tagal Churna we can give. Yes.
Thank you for your wonderful explanation, sir. Now I request Dr. Sidram sir to just say a few words about the sessions.
Namaste, sir.
Namaste, sir.
I think we had a brainstorming session today here, Dr. Rajnikant Patel ji. So I know him since COVID. We were the common group members for 2 or 3 WhatsApp groups. And I can say that he has done a commendable job in the treatment of mucormycosis. Since then, he is still continuing with that. And we also came to know that he is treating many of the critical cases through Ayurveda successfully. We thought that he is the right person to encourage and enrich our students and the Ayurveda fraternity at the large. And Sir has spoken about his cases, how the critical were, and how he managed to take them to a logical end. And in many of the cases, he has given the wonderful results among them. And looking at the number of questions he has got, I think that students and Ayurveda fraternity really need your help to grow in their professional life. That is what I have came to know looking at the questions. Thank you, sir, for accepting our invitation. So we hope that we will continue our association in the future to come.
Sure, sir.
We ask your help to come again in the platform to guide our students and all the scholars who are in need. Thank you, sir.
Yes. Thank you.
Now I have hand over the platform to Dr. Sanjay sir for his concluding remarks.
Hello, sir.
Namaste, sir.
Myself, Dr. Sanjay. I'm
Yes,
professor
sir.
in postgraduate department of Ayurveda, Kayachikitsa department, JMC, Mysore. Dr. Sidram sir has once told that we have a very young and energetic practitioner of Ayurveda who has been doing a wonderful job in management of some rare and very critically ill patients, usually requiring modern medicines. And we need to hear from him. Then I was also eagerly waiting for your session, sir, because everybody knows that in Ayurveda, managing regular our own diseases which usually come to regular Ayurveda, seeking Ayurveda medicine itself is difficult. In such scenario, treating cases, especially very critical or emergency management requiring cases, mostly managed by modern super specialties with a lot of infrastructural support, is really challenging. And in fact, I was astonished and overwhelmed by your presentation, the data that you have collected, and the neat presentation that you have made. Surely, not only for students of Ayurveda, it is motivating to other practitioners also. You have really analyzed the cases, taking modern pathology and the depth of Ayurveda understanding into consideration and all. Uh, the medicines that you have used are unique also. So maybe as the NCSM is insisting on every institution to have a emergency OPD and emergency management setup, most of
They
the
must.
colleges uh, probably they don't have trained. They're not trained enough to treat such cases. Probably your presentation is a eye opener to just go on, maybe with your support also, or with the constant interaction. Every college can run a acute Atyayika OPD, I suppose. So it was very good presentation, sir, and very rare, in fact, presentation I can say. So I thank on behalf of the students of this, undergraduate students and postgraduate students of Kaya Chikitsa, all the staffs of Government Ayurveda Medical College, the principal, the HOD. In her absence, I am attending her session, sir. So I wholeheartedly thank you for sparing your valuable time,
Thank you,
and
sir.
also you're
Yes,
open
sir.
to share your knowledge. Most of the time, what happens is the people who work on that may not be open to share the knowledge in a transparency. But you're a very unique person, and I'm very happy that I heard you, and our students also got benefited by your presentation. As Dr. Sidram sir has told, probably we'll have a continuous interactions, and we'll continue our association. We are celebrating 50th year of academic excellence in Kaya Chikitsa, the Golden Jubilee celebration. As a part of that, we have been conducting many webinars. We are calling stalwarts, people who are busy, who cannot come by in person to our institution through webinars. And I'm really happy to have you also, sir. And you made a justice for such invitation. Once again, I wholeheartedly thank you on my
Thank
on
you.
college behalf and personally also. Thank you very much, sir.
I would like to thank Dr. Sanjay sir and Sidram sir for their kind and appreciating words. Now I request Dr. Sangeeta, second year PG scholar from the Department of PG Studies in Kaya Chikitsa, to say a vote of thanks.
Very good afternoon to everyone. On behalf of Government Ayurveda Medical College, Mysore, I express my heartfelt Thanks to our guest speaker, Dr. Rajnikant Patil sir,
for providing us with an amazing session and giving us a new perspective in treating critical cases in Ayurveda, which is usually a challenging for us. Thank you very much, sir.
I would
I would
also like
also
to
like to
thank
thank
our
our
principal
principal,
sir,
sir,
Dr.
Dr.
Gajanan
Gajanan
Hegde,
Hegde, for being a constant support to us.
I
I
would
would
also
also
like
like
to
to
extend
extend my sincere thanks to our beloved HOD, Dr.
Maitreya
Maitreya
Asli
Asli ma'am, for her
constant
constant
guidance.
guidance.
And
And
I would
I
also
would also like to extend my heartfelt thanks to Dr. Sanjay Kumar, MD, Professor, and Dr. Sidram Guled, Assistant Professor from Department of Kaya Chikitsa, for their constant support, and the PG College for their great teamwork. Lastly, I would also like to thank all the virtual participants for their active participation. Thank you, one and all.
I think we end one session.
Sir,
Okay, finish. Yes.
thank, thank you for your wonderful session, sir.
Thank you. Thank you. Shall I leave now?
Yes, sir. Okay, sir. Thank you, sir.
Okay, thank you very much.
in audience ಎದುರಲ್ಲಿ ಕಾಮಿಕೆ ಯೂಟ್ಯೂಬ್ ಅಲ್ಲಿ